Good day everyone. So welcome back to my channel. I am Dr. Kedar. I am a senior consultant in pediatrics, infectious diseases, allergy and asthma in Ankura Hospitals in Kukatpalli, Hyderabad. Today we'll just discuss about a very interesting child that I have seen in the past 1 week to 10 days ago. This is a 6-year-old child who came to me in the outpatient department with complaints of generalized weakness, and he was telling me the complaint that he was able to hear his heartbeat, which is actually beating very fast. By hearing the complaint, I asked the patient to sit beside me and then I examined the child. And I found out that an approximate heart rate was more than nearly 200 per minute. This is in fact very high for a 6 to 7-year-old child. So when the heart rate exceeded 200, I was a little bit worried. But the parents were really cool and they didn't know the gravity of the situation. They were not in a... I can't put them in a state of panic by telling them a lot about this increased heart rate. Then when I really checked, I immediately took the child to the emergency room and I checked the heart rate. The heart rate was nearly 218 to 220 per minute. This is what has really worried me. In medical terms, this is called as Supra-Ventricular Tachycardia. If the heart rate exceeds a certain number for that age, it is called as Supra-Ventricular Tachycardia. What actually happens in this Supra-Ventricular Tachycardia or an increased heart rate is the rhythm of the heart gets disturbed and it beats without a rhythm, without in sync. So the filling of blood into the heart and pumping of the blood outside the heart takes a hit. This is the reason for all the complications. Sometimes the child might faint because of the low oxygen supply to the brain, or sometimes there could be a sudden cardiac arrest. These are the two very important things that I have kept in my mind. So once I took the child to the emergency room and examined the child, the heart rate was more than 218 per minute and an ECG taken was showing an absent P wave. So in the ECG, a typical rhythm was not present. The rhythm was disturbed. So in the ECG, we usually see PQRST. The P wave is absent with a narrow margin, which indicates a supraventricular tachycardia. Once the diagnosis is confirmed, now what am I supposed to do? The treatment for supraventricular tachycardia is emergency injection, giving an injection which is called as adenosine. So by inserting a cannula into the vein of the child and by putting a 3-way, a rapid injection of adenosine was given and immediately the child reverted back to normal. Then I sat with the parents and explained them the problem. So the problem is, supraventricular tachycardia, what treatment I have given, how many days it will take and what are the possible complications in future. So this is in fact a medical emergency which I thought all the parents out there should know about it, so that if at all you feel that the child is having a rapid heart rate or a child complains of palpitations, so probably you need to seek medical attention immediately. So next is what could be the possible causes of the supraventricular tachycardia. Usually high-grade fevers, thyroid disturbances and certain drugs, these are considered to be the causes of supraventricular tachycardia. This is a medical emergency and should be brought to the attention of a medical specialist and immediate treatment has to be given. So with this information, I thought it could be useful for a lot of parents out there. So thank you. And for more insights in medical science like this, please subscribe to my channel. Thank you.